Hey guys, so as promised in this video, I am going to be going over my personal experience with RFF Phalloplasty. Back in 2021, I had phalloplasty with Dr. Meng Chen and Dr. Andrew Watt from the Bunkie Clinic. This is all from my own personal experience, so please do your own research, consult with your surgeon. This is all for educational purposes, but I am not a licensed medical professional, so do your own research. So I'm going to go over the timeline of what to expect post-op in depth. I will be referring to the bottom surgery guide that I created. You guys can follow along if you'd like. Just head to the link in my bio and you can download the bottom surgery guide PDF for free. Okay, so recovery. You will wake up from surgery with a few things attached to you. An SP tube, a Foley catheter, an IV, an arm drain, an arm cast, and I actually had 6 drains total on me. So I was in the hospital for 5 days. I thought that I had a high pain tolerance, but I did not. Those first couple days in the hospital were extremely painful for me. I was constantly pressing the medication button. The bladder spasms are probably the most uncomfortable. It's because that catheter is moving around in your bladder. But my surgeon gave me some really good meds for that, so definitely ask for bladder spasm meds. Be prepared also in the first couple of days. The nurses will have to wipe your butt. You're gonna be on bed rest, you're not gonna be moving, and you're gonna have to go to the bathroom eventually. Luckily, the nurses that were taking care of me were very nice. They were very respectful, they were very, very professional. So as embarrassing as it was for me to be like, sorry, you gotta wipe me, they really made the experience better than it probably could have been. Now, they typically will start to get you up and walking on day 2 or 3, and that will require a lot of energy. You will be very, very tired after that. Surgery really wipes you out. Now, the most pain that I experienced was from the scab on the donor site of my thigh. What they do is they take a thinner graft from your leg and they put that on the arm to replace the skin that they took from the arm. And then they cover the leg with gauze. And basically, I bled through the gauze and then it scabbed over. The gauze helps protect, your leg while it's starting to heal and the skin is starting to regrow. So you're supposed to bleed through it, scab over, and then you're just supposed to let the scab naturally fall off. But the thing is, that thing will pull and crack every time you move. It's very painful. Eventually that gauze though will peel off and it will reveal the new healthy skin underneath. But that takes a really long time. So just be prepared for that. It takes a few weeks. Also in the first few days, the nurses would come in and check on me and they would check on my phallus. They would use an ultrasound and check and make sure that all throughout there was a heartbeat. Because they want to make sure that you have good blood flow. It's very vital in the very first week to check that. It was really cool because I got to hear my heartbeat in my phallus. So you're going to want to schedule your hand therapy ASAP. Scar tissue develops really quickly and your arm's going to be in a cast. You're not going to be able to move anything. You're going to need to work through the scar tissue to get your strength and your mobility back. My hand therapy was scheduled 5 days post-op, so definitely get in there quickly. You're going to have a bunch of post-op appointments, so try to stay close. Stay within 20 miles of your surgeon for the first 10 days. Trust me, you're not going to want to sit for very long. You're going to want to lay back, because you're going to have a lot of stitches in your perineum between your legs, and trying to sit in a car for more than 20 minutes is very painful. So stay as close as possible. And when you do sleep, sleep in a recliner, because again, you don't want to put tension on those stitches. All right, so now I'm going to go over the timeline. So I had to keep my arm elevated, propped up on a lot of pillows for 5 to 6 weeks. This is because your hand is going to swell. And I remember all of my fingers, my entire hand was extremely extremely swollen. You have to keep your arm elevated so that all of that liquid can start to drain. Once you're allowed to take the arm cast off, you are only allowed to put Aquaphor on your arm. It's the safest thing, it's the best thing. You need to keep your graft from getting dry and cracked. Walking. I was told I needed to walk 1 hour a day. Didn't matter if it was split up into 30-minute segments, 10-minute segments, as long as I walked 1 hour a day. And if you can, make sure that your caregiver is walking with you, because it's harder than it looks. You're gonna be tired, you're gonna be in pain, you're probably gonna lose your balance. I definitely relied on my caregiver at the time to help me walk and not trip. Plus, you can only take small steps anyway, because you're not supposed to spread your legs too far, because again, you could tear those stitches. Again, 5 days post-op, you're going to do hand therapy and stretching. Also, I did hand therapy for 6 months, and it was totally worth it because I had a lot of scar tissue. It was very painful to work through. All of this skin was so tight that I couldn't even twist my arm. So we worked through all of this, the scar tissue, breaking it up. You can see that like my tendons glide. I don't know if you can see actually, but my tendons glide, whereas they used to get stuck. But I have full range of motion and full strength. I go to the gym. I don't have any issues with my left hand or arm. 7 days post-op, you're allowed to take a shower. I did not wash my arm though, because I still had it all wrapped up and everything. I got a special shower protector. It was a big piece of plastic that basically just goes over the arm and it seals with like some rubber. And then that way I felt comfortable being in the shower and not having to worry about getting any of the gauze wet. And you will need assistance in the shower. You cannot do it by yourself. And I highly recommend getting yourself some sort of shower chair or stool, something that you can sit on. 3 to 3.5 weeks post-op, you will be able to pee, stand to pee without the catheter. Typically, if there are no complications. I had complications. I had fistulas, which basically means that the plumbing wasn't healing properly, it wasn't hooking up right, and there were holes, there were leaks. And I couldn't stand to pee until those leaks healed properly. So I had to go back in for 2 repair surgeries to fix those fistulas. Unfortunately, that took 8, almost 9 months for those surgeries to take properly. So I had a catheter for 8-9 months before I could stand to pee on my own. It sucked, but I got through it and I can stand to pee just fine now. But I remember being extremely disappointed that I couldn't get the catheter out and I couldn't stand to pee on my own. So just be prepared and expect complications, because if you think that everything is just going to go smoothly and then it doesn't, it can really take a toll on your mental health. And I learned that firsthand. At 4 weeks post-op, you should be allowed to drive. At 6 to 8 weeks post-op, your wounds should be fully closed and healed. Once you get to the 6 to 8 week range and your arm is completely healed, that's when you can start wearing, the compression sleeves with the silicone sheets. So at 6 to 7 weeks post-op, I started wearing these Care silicone gel sheets. I put one here and one here. And then I put a compression sleeve on it to keep them, firmly against my skin. And I put those silicone sheets on. Clean arm, no lotion, nothing, just clean arm. I recommend wearing the compression sleeve with silicone sheets daily for 1 year. But if you notice that your scar has smoothed out, it's fading, it's healing, it's softening up, and you don't feel like you need it anymore, then you don't have to wear it. But I feel like I got really good results with smoothing out my scar with the silicone sheets and the compression sleeve. And then once you're done with the compression sleeve and you just want to protect your arm from the sun, I recommend Tattoo X sleeves. It's just a lighter sleeve. It doesn't compress your arm and it just slips right over, and it's perfect. Like, it perfectly covers the forearm. And my surgeon said that at 6 to 8 weeks post-op, you can start to exercise, but you just have to do it very slowly and ease yourself into it. Then at 8 to 12 weeks, typically you can get back to normal exercise. And then once you're 3 months post-op, you should be able to get back to vigorous exercise. But also don't push yourself, listen to your body. Swimming and baths. You cannot submerge your wounds in any kind of water until you have fully healed. So that usually takes about 6 to 8 weeks. Once they're fully healed, feel free to get in the bathtub or go swimming. I'm not entirely sure what words I can use on here without getting my content suppressed or flagged or whatever, so I'm just gonna say fun time with a partner. My surgeon told me that it is safe to stimulate at 6 weeks post-op, but no penetrating anything for 8 weeks. Now, typically you can get back to work 2 to 3 months after stage 1. The other stages should be less intense, but typically with physical jobs, still wait 12 weeks. But office jobs where you're sitting most of the time, you could return sooner. Okay, so if you have leftover hairs, residual hairs on your phallus, you can get electrolysis after stage 1. My surgeon told me, because I did have just a few residuals, my surgeon told me to wait until I was at least 3 months post-op from stage 1 before I could go in and get them zapped. And I will say this, the sooner you get that done, the better, because once you start getting feeling in your phallus, the electrolysis on there can be very painful. It's kind of bittersweet because it's like, it's painful, I can feel that, but at the same time, holy crap, I can feel that. That's amazing. Now, stage 2, which is typically the glandsplasty and the testicular implants, that is typically done 3 to 4 months post-op from stage 1. You can wait till 4 to 6 months post-op, but my surgeon said earlier is better. Then stage 3, which is the penile implant, if you so choose to get one. Not everybody wants one. You don't have to do stage 3. But if you do go with the penile implant, which is typically a rod or a pump, you have to wait till you're 1 year post-op from stage 1. I have the Titan Coloplast pump, and I love it. Tattoos on your arm. My surgeon said to wait until at least 1 year post-op to 16 months. I would recommend waiting 2 years because it takes a while for the graft to settle. And the skin is very, very thin. So if you go to someone, make sure you are choosing a tattoo artist who is familiar with scar tissue, scars, skin grafts, burns, because this skin is a lot different and, again, much thinner than this. Tattoos on the phallus. You can get tattooing on your phallus. I know a lot of guys will get veins tattooed in, shadowing, shading, some color. My surgeon said to wait until all stages are complete. Last, but definitely not least, nerve hookup sensation. Now, the nerve hookup is when the surgeon takes the nerve from the arm and hooks it up to the groin and the nerves down below. That's what allows me to feel erotic sensation, as well as all of the other sensations. Nerve hookup sensation can take 1 to 2 years to come in, and it'll keep coming in over those first 2 years. I started feeling sensation at 9.5 weeks post-op, and it's the trippiest thing. Like, it's a new part attached to me, and I like feeling it for the first time was just, it's amazing what surgeons can do. It's amazing what nerves can do. It really is like magic, because you go from one day being completely numb to all of a sudden, I feel something. It's so cool. And if you guys are following along with my bottom surgery guide, there is also a list of supplies that I recommend you get. And yeah, that's pretty much it. I know bottom surgery can be a very scary experience. It's an intense experience. It is the most intense surgery that I have had. It is not one to take lightly. Do your research diligently. Everybody heals differently. Everybody's experience is going to be slightly different. But I really, truly hope that by sharing my experience with surgery, that hopefully it helps you guys just not be as anxious about it, because even though I had complications, once I got through them, I am so happy with my results, with the euphoria that I feel every day. It's kind of like with top surgery when you're just like not wearing a shirt every single day. I'm always checking out my bulge. I'm always looking at it in the mirror, standing to pee, being able to walk into a men's room and go to the urinal and feel safe, or to feel safer in a stall. Overall, I just feel safer. I feel more complete. I feel euphoric. I don't have any bottom dysphoria anymore. And for me, that feels like a miracle. I do have a couple more videos coming. I am going to be talking about specifically arm scar care and thigh scar care. And then I'm also going to be putting together a video on hand therapy exercises. What I did while I was on bed rest and what I did with my therapist to get my full range of motion back. So yep, I hope this helps, and I will catch you in the next video.